They call them routine checkups, but once a woman reaches her 70s, certain tests can actually bring more harm than help. You're told prevention is the goal, that more screenings guarantee a longer life. But behind the white coats and polite smiles lies a billion-dollar industry quietly pushing risky, unnecessary exams. Radiation, false alarms, overdiagnosis, and even harsh treatments that were never necessary in the first place. This is the hidden reality. The worst part, most older women never hear it. Instead, they're pulled into a cycle of constant testing, stress, and repeat procedures, while big pharma and insurance giants profit enormously. Tests meant to protect can backfire, triggering fatigue, anxiety, hormone crashes, and even organ damage. One preventive screening might raise your stroke risk. Another could leave you with infections that last a lifetime. And here's the kicker. A 2021 study found that 42% of older adults underwent at least one unnecessary test that caused avoidable harm. In this video, we'll uncover 5 medical checkups that women over 70 should think twice about. They're ranked from the least to the most dangerous. Pay close attention to number 2. It's still promoted in nearly every hospital, yet research shows it might double your risk of cognitive decline. Before diving in, let me ask you a couple of questions. Have you ever noticed that some tests leave you feeling worse than before, or wondered what the latest medical research actually says about which checkups you still need after 70? We'd love to hear your thoughts. Leave a comment. We're reading every single one and giving personalized advice. Let's start with number 5. And here's the part your doctor probably won't mention: bone density scans. For many women past 70, these DEXA scans are ordered during routine visits. Their purpose is to detect osteoporosis, a condition that makes bones weak and brittle. While it sounds helpful, the reality is more complicated for seniors. By the time a woman reaches her 70s, some bone density loss is natural and expected. But here's the problem. Research shows many of these age-related changes aren't serious enough to need medication. In fact, a 2015 report revealed that over 60% of women diagnosed with mild bone loss were still prescribed strong drugs. These medications can bring serious side effects: jaw decay, spontaneous fractures, and ulcers in the esophagus. What's worse, most of these women were never truly at risk of breaking a bone. The flaw comes from the T-score system, which compares a 70-year-old's bones to those of a healthy 30-year-old, making normal aging changes look alarming. Imagine comparing the skin of a 70-year-old to that of a 30-year-old and calling the difference a disease. That's exactly what happens here. A 2018 study found that women over 70 with no fracture history and a T-score above -2.5 faced less than a 3% annual risk of hip fracture. For most women, that means they're safe without medication, as long as they keep up simple habits like strength training and balance exercises. If you're over 70 with no fracture history, it's often better to skip the scan unless you've had a fall or show real signs of fragility, such as losing height or a stooped posture. When necessary, tools like FRAX, a test that calculates fracture risk using many personal factors, can give a clearer picture without rushing to medications. Take Margaret, a 74-year-old retired librarian and avid gardener. After a scan, she was put on bisphosphonate drugs, even though her true risk was low. Within weeks, she developed severe heartburn, had trouble swallowing, and was hospitalized with esophageal damage. Reviewing her scan showed her fracture risk was minimal. Her lifestyle, daily walks, calcium-rich meals, and sunlight was already protecting her bones naturally. Just 1 cup of grapes has 23 grams of sugar, almost 6 teaspoons absorbed straight into your blood. The stroke link comes from glycemic variability. When sugar spikes quickly, your body releases massive insulin to compensate. That surge inflames vessel walls and makes your blood far more likely to clot. No scan required, just movement, good nutrition, and time. Coming up is test number 4, one you've likely taken every year. But this routine blood panel might secretly be harming your kidneys. These panels usually check cholesterol, blood sugar, electrolytes, liver, and kidney function. At first, they look like smart prevention. But aging kidneys often slip through undetected, and sometimes these tests make things worse. One of the main markers used is serum creatinine, a waste product filtered by the kidneys. Doctors often rely on serum creatinine to estimate kidney health. But here's the problem: this marker is strongly influenced by muscle mass. After 70, women naturally lose muscle, which makes their creatinine levels appear normal, even while kidney function is quietly deteriorating. As a result, many seniors could be unknowingly living with stage 2 or even stage 3 kidney disease without realizing it. A 2022 study published in the Clinical Journal of the American Society of Nephrology revealed that standard creatinine-based tests missed early kidney disease in more than 35% of women over 70. The researchers urged a shift toward a more accurate marker, cystatin C, which provides a clear picture of kidney health and is not affected by muscle mass or age-related changes in the body. Things can get worse when these routine panels create a false sense of security. Doctors may unknowingly prescribe kidney-toxic drugs. Common culprits include NSAIDs for arthritis or certain blood pressure medications. With kidneys already vulnerable, these drugs can push someone into rapid decline. This is exactly what happened to Donna, a 76-year-old retired schoolteacher who walked 3 miles every single day. She came in exhausted, complaining of swollen ankles. Just 2 months earlier, her standard blood panel showed normal results. But when we ran a cystatin C test, the picture changed dramatically. Her estimated GFR, which measures kidney filtering power, was only 44. That meant stage 3B kidney disease, a serious condition that explained her troubling symptoms and ongoing fatigue. That result forced us to stop a medication that had been silently damaging her kidneys. Within 2 months, Donna's energy returned, the swelling faded, and her kidney function stabilized. The lesson is clear: if you're over 70, especially if you are thin or have lost muscle mass, ask your doctor for a cystatin C test alongside or instead of creatinine rather than relying on outdated panels. Cystatin C is far more reliable and since 2021 has been officially recommended by the National Kidney Foundation for elderly patients. But there's another hidden problem: frequent blood draws themselves can create unnecessary stress. Slightly abnormal results like a marginally high liver enzyme or a low sodium level often lead to follow-up scans and treatments, piling on anxiety without delivering any real benefit. Older women in stable health often benefit more from care guided by symptoms instead of endless lab numbers. In other words, medical attention should focus on how you actually feel and function. Now here's where it gets more shocking. A scan that's been promoted as a lifesaver may in fact double your risk of memory loss after 70. This is checkup number 3. Number 3, CT angiograms. After 70, many doctors recommend heart evaluations, and this test has become one of the most common. A CT angiogram uses contrast dye to create detailed images of your heart's blood vessels. It's often used to rule out coronary artery disease, the condition where arteries narrow and increase the risk of heart attack. But when used too freely in older women without clear symptoms, this scan can quietly create harm. The procedure requires a powerful contrast dye that your kidneys must filter out. And as we've seen, aging kidneys are far more fragile than test results suggest. If they can't clear the dye, it can trigger what's called contrast-induced nephropathy, sudden acute kidney damage. An even bigger concern, a 2021 study published in Stroke found that older adults who underwent multiple contrast scans within 5 years nearly doubled their risk of developing vascular dementia compared to those who didn't. Why? Because contrast dye can sometimes trigger tiny clots or disturb blood flow in fragile brain vessels. The danger doesn't show up immediately, it builds over time. The damage sneaks in slowly. It often begins with small lapses, like forgetfulness or confusion, then progresses into more serious problems. Most patients never suspect the scan is the cause. Take Teresa, age 79. She underwent 3 CT angiograms in just 4 years. Her first scan was ordered for mild chest pressure during exercise, something later traced back to simple winter inactivity, not heart disease. Each time Teresa's arteries showed no serious blockages, but months after her last scan, her family began noticing troubling changes, memory lapses, mood swings, and difficulty following conversations. Reviewing her medical history revealed no obvious risk factors for dementia, no diabetes, no smoking, no head injuries. The repeated contrast scans were the only thing that stood out. We supported her with cognitive rehab, adjusted her blood pressure medication to improve brain circulation, and helped her regain some function. But the damage was clear. So when are CT angiograms actually necessary? If a woman over 70 shows signs of unstable angina, such as chest pain at rest, shortness of breath during light activity, or sudden fainting, then the scan may be justified. For patients who are stable with only mild or vague symptoms, safer options exist. A treadmill stress test with ECG monitoring can reveal heart risks without exposing the brain or kidneys to contrast dye. Another alternative is a coronary calcium score, a low-dose CT scan without contrast that measures plaque buildup in arteries to assess long-term heart risk. These safer tests are especially useful for evaluating long-term risk, yet many women are never told about them. Instead, they trust the CT angiogram without knowing it could silently harm their brain years later. The system prefers quick answers, but at what cost? Up next is number 2, the most overused test for older women, still pushed in hospitals today despite clear evidence of overdiagnosis and anxiety. Number 2, routine pelvic exams. This might surprise you. Millions of women over 70 still undergo these exams each year, even when they have no symptoms or risk factors. Yet a 2017 recommendation from the U.S. Preventive Services Task Force stated there is no solid evidence that routine pelvic exams in asymptomatic women reduce cancer deaths or improve outcomes. The truth is, routine pelvic exams can cause real harm. False positives are common findings that look abnormal but are actually harmless. These often trigger a chain reaction of ultrasounds, biopsies, and even surgeries, each carrying its own risks. For older women, the risks are magnified thinner tissues, higher infection rates, and slower healing. The proteins released from his destroyed muscles formed clots that traveled to his brain. For anyone on medication, the only safe amount of grapefruit is 0. Even people not on prescriptions must be cautious, since grapefruit's effects linger for days and can interfere with common over-the-counter drugs like antihistamines. But once found, they create fear. Many women feel pressured to take action even when simple monitoring would have been enough. This is exactly what happened to Eleanor, a 75-year-old former chef. A routine pelvic exam detected a small ovarian cyst, leading to an ultrasound, then a CT scan, and finally a surgery just in case. Terrified of cancer, Eleanor went through with the surgery. The mass turned out to be just a harmless, fluid-filled cyst common after menopause. Yet she spent 5 days in the hospital with complications and 6 weeks recovering from a surgery that never needed to happen. The emotional toll was crushing. She later said she felt like a ticking time bomb, only to learn there was never any danger at all. So when is a pelvic exam truly needed? Only when clear symptoms appear: pelvic pain, abnormal bleeding, or pressure. For older women who feel fine, especially those who have already had a hysterectomy or completed cancer screenings, routine exams provide little benefit and often cause more stress than reassurance. A better approach is symptom-guided care exams, and scans should be done only when there's a reason. If needed, a transvaginal ultrasound offers detailed imaging with less risk. And newer blood tests like CA 125, though not perfect, can also help evaluate risk without rushing into invasive procedures. Finally, number 1, the most aggressively promoted test of them all. Colonoscopies past 70 are often praised as the gold standard for cancer screening. They're recommended, widely marketed heavily, and treated like a rite of passage once you turn 50. Yet after 70, this procedure may quietly do more harm than good, raising risks for memory, gut health, and even sepsis. By this age, especially if you've already had clear results before the risk-benefit equation changes. A colonoscopy involves inserting a flexible tube with a camera into the colon to check for polyps, small growths that can sometimes turn cancerous. But to do this, the colon must be fully emptied with a powerful laxative prep, and that's where problems begin for older adults. The prep solution is extremely dehydrating. It flushes the entire digestive tract, stripping away not just waste, but also vital electrolytes and beneficial bacteria that protect gut health. For older women whose hydration reserves are lower, this rapid flush can trigger dangerous drops in blood pressure, kidney strain, and serious electrolyte imbalances that may require hospitalization. A 2016 study published in the American Journal of Gastroenterology found that nearly 28% of patients over 70 experienced moderate to severe dehydration from colonoscopy prep. Symptoms included fatigue, dizziness, and in some cases, hospitalization. But the bigger concern comes afterward. The colon houses trillions of bacteria, the gut microbiome that supports immunity, hormone balance, and even brain health. After a colonoscopy, especially when polyps are removed, this delicate ecosystem can be disrupted for weeks. The gut barrier that normally keeps harmful bacteria out of the bloodstream can weaken. If it breaks down, the door opens to sepsis, a life-threatening body-wide infection. In fact, a 2019 study reported that older adults had a 12-fold higher risk of sepsis hospitalization within 10 days of a colonoscopy with biopsy compared to the general population. Many of these sepsis cases occurred in people with no prior symptoms who underwent colonoscopy purely as a preventive measure. But that's not the only danger. Most colonoscopies use sedation to keep patients comfortable, and for adults over 70, especially those already vulnerable to cognitive decline, anesthesia itself can be risky. It has been linked to short-term delirium and long-term memory loss. A 2020 study in anesthesia and analgesia revealed that 41% of seniors experienced measurable cognitive decline after outpatient anesthesia, and the changes lasted for at least a month. Joan, age 81, a retired piano teacher who loved crosswords and storytelling, learned this the hard way. She had a clean colonoscopy at 72, but her new doctor urged her to repeat the test just to be safe. The prep left her weak and dizzy. 2 days later, Joan developed a fever and confusion. She was rushed to the hospital, diagnosed with sepsis, and spent 4 days in intensive care. Though she survived, her daughter later admitted Joan was never quite the same. Her memory slipped, her appetite dwindled, and the worst part, the test hadn't found anything dangerous at all. So when is a colonoscopy truly necessary after 70? Only in specific cases, if a woman has never been screened before or if she has concerning symptoms like rectal bleeding, unexplained anemia, or chronic digestive pain. But for women with clear past results, no symptoms now, and a life expectancy under 10 years, major guidelines, including those from the U.S. Preventive Services Task Force, recommend stopping routine colonoscopies. Safer alternatives do exist. Non-invasive stool tests like FIT, the fecal immunochemical test, can detect hidden blood and be done right at home. Recommended annually for seniors who still qualify, these tests have a high detection rate for colon cancer without the serious risks tied to sedation or bowel prep. So there you have it. 5 health checkups are often recommended for women after 70, but if used blindly, they may cause more harm than good. Bone density scans, routine blood panels, CT, angiograms, pelvic exams, and colonoscopies all can help, but only when used wisely. Each test holds the power to heal or to hurt depending on timing, context, and whether your body truly needs it. The most powerful medicine isn't a test or a machine, it's personalized care. Real health comes from looking at symptoms, risks, and conversations with doctors who understand aging. Before we close, let me ask you, have you or someone you love ever regretted getting a test or procedure that turned out to be unnecessary? What's one health decision you're glad you questioned or researched first? Share your answers in the Badias comments. We're reading and replying to every single comment with personalized tips to help guide your choices. Your story might even save someone else's life. Thank you for watching.